Hey guys, Dr. Anderson here. I'm here to talk to you about chronic pain. Now that can come into your life with different labels. Could be called complex regional pain syndrome. Could be called sympathetic or reflex sympathetic dystrophy, RSD for short, and complex regional pain syndrome is called CRPS for short. But oftentimes you may have an injury in the foot or lower extremity, and afterwards, maybe after a surgery, for example, you have this problem going on. You have burning and tingling and numbness and a lot of discomfort. We have Angela here. She comes all the way from Ohio. Her history is that about 3 years ago, she broke her ankle. And the surgeons went in and probably did a great job of putting things back together, but she has a scar right here. And she came in for another opinion from us. And this is right along a nerve pathway called the sural nerve. And this little sural nerve comes down the leg. It doesn't supply any muscles or anything. It just supplies your skin. And I noticed there's lots of sensitivity along the nerve branch. So what we did, we wanted to see if the nerve branch was involved in this scar, meaning either during surgery, maybe the nerve could have got a little bit stretched or injured, or after surgery, the scar will injure and adhere to the nerve branch, causing this kind of chronic pain. And actually, she's fortunate because some people can have horrific pain, really bad pain, and it can take them down a pain management pathway of treatment and medicine where they might have to be on narcotics. They might even have to have a nerve stimulator put in their back. Her symptoms don't seem to be that severe, but believe me, they can be. And if you're hearing me and you're listening, make sure you might want to consider this kind of treatment, but you have to see a peripheral nerve surgeon. Many doctors are not trained to properly evaluate. So what we did, properly evaluate peripheral nerve issues. So what I did about 3 weeks ago, she came all the way back from Ohio, by the way, thank you. but and I think it's worth it because what, you're how much better are you?
Oh yeah, like 95 better, 95%
95% better, right?
Yep.
So pretty much back to normal. What had the doctors back there told you would have to do?
That my only option was to get surgery and take the hardware out.
So so go back, a lot of work, go back in, take out the bone screws and probably the plate that's in there, take hardware out. So we injected her, 95% improvement, and we're going to do it again. Now, to be fair to her, and I think we talked about this, if it kept coming back in spite of these injections, possibly the next step might be we find the nerve up above here, we actually go and find it, we excise the branch and bury it in muscle there. A lot less layup and maybe a little bit less risk than taking out the hardware and such. So another way to approach this, I just want you to understand that whenever you have injury, maybe it could be an ankle sprain, or maybe it's from a surgery that you had the foot or ankle. Understand that. That's what we do here. We take care of the nerve conditions that result from that, and it's a whole other way of approaching at it and looking at it. So really appreciate her volunteering for this. And if you want more information about this, we've got other videos on complex regional pain syndrome. Also, another term is reflex sympathetic dystrophy. Please subscribe to your YouTube channel to learn quite a bit more. It's an alternative way that we can help you, and you don't have to put up with this pain if you've been told that you're a chronic pain patient. And the blessing is, if you have really bad pain, it's a way to help you get off narcotics or avoid going under our narcotics for these chronic pain issues. So very important to understand that's something I'm very passionate that you need to know about as an alternative. So, and you may not hear a lot about it. Angela, thank you for coming in.
Thank you so much for
it sounds like we're going down that right pathway.
Yeah.
Okay, thank you much.